Welcome. My name is Diana Doss and I am an RN. Today I will be presenting to you a PowerPoint in which I have created based on information gathered from scholarly peer-reviewed articles. This presentation is intended to provide healthcare providers with tools to provide culturally competent nursing care across the lifespan of Russians and people identifying themselves with the Russian culture, more particularly Russian immigrants from the former Soviet Union, speaking primarily Russian. Common barriers to healthcare delivery, such as communication and understanding, will be addressed. Methods in assisting acculturation will also be provided. At the conclusion of this presentation, one should have gained a better knowledge of how to provide culturally sensitive care to the Russian clients of all ages. In the Russian culture, the mentality of collectivism is seen, referring to we versus the typical self-indulged I mentality of Americans. This is believed to be a result of the communist rule in which people had to rely heavily on one another. This is important to know when inquiring about the history of a Russian client, for it has been found that when gathering a health history, the client will refer to historical events as I when speaking English and we when speaking Russian. The majority of Russian immigrants are Jewish but do not associate spiritually with physical healing. Although the lengthy rule of communism in Russia led to distrust of figures of power of authority, including American doctors, Russian immigrants continued to have an unrealistic view of American medicine. These clients are very educated and will self-manage care if they feel that they are receiving care that is inadequate. Russian people limit their expressions of joy. They are shown to be motivated more by sadness and negative emotions. Russians report a decrease with satisfaction of life and an increased risk of depression and suicide. Russian men are prone to alcohol addiction and require frequent assessment for dependency. Men are expected to provide financially for the family, while women are to maintain the family and society. Education is highly valued, most people having attended some form of secondary schooling. Traditional Russian homes are comprised of 3 generations, with a high value placed on family ties and friendships. It is not uncommon for friends to disclose more personal information than spouses. Health is valued to be of higher importance than that of beauty and wealth. As mentioned earlier, these clients will self-manage care due to lack of trust in American doctors. In Russia, a good doctor was perceived as a doctor who prescribed few pills while still having success in treating illness. This is very different compared to the American doctor who is perceived as good if he or she prescribes many pills. Russians view pills as chemicals and prefer more natural methods of healing such as herbs, roots, and the use of a zenari, or a traditional healer, and babki, or an old woman who performs removal of the evil eye. Hope is an essential part of the desire to live for these clients. If a client is diagnosed with a terminal illness, typically the client is not informed of the illness for fear of losing hope and no longer fighting to live. These clients do not believe that factors such as food shortages and housing shortages result in illness. Illness is perceived to come from pollution, evil eye curse, and stress. Women play a major role in the Russian culture. Women maintain the family unit and society by taking control of the household and children, managing finances, and maintaining meaningful careers. Traditionally, women will remain unemployed to take care of elderly parents. Present day in the Americas, women tend to hold jobs outside of the home. Despite being a key element to the family, Russian women are 4 out of 5 times more likely to be victims of domestic violence. This is linked with the increased unemployment of Russian men and increased alcoholism. During the Soviet Union era, abortion was the most accessible form of contraceptive use. When oral contraceptives were introduced, women were reluctant to use them due to the rumored unpleasant side effects. The availability of abortions make them a first resort for women still today. By the age of 25, the average woman has had 3 abortions. Due to the complications associated with these abortions, women reported a lack of contraceptive use due to perceived infertility. Russian women have had a lack of formal teaching on contraceptives and would benefit greatly from education on family planning and sexually transmitted illnesses. Children of Russian immigrants are expected to be submissive to parental authority figures. Traditional culture promotes independent relations, yet fosters feminism. Parents are typically highly involved in the children's lives. Children are encouraged to excel in academic and avocational matters. Thus, they have decreased literacy rates and increased writing, science, and sports skills. They struggle with cultural integration of the American way of autonomy. Nurses are encouraged to assess parenting styles, promote autonomy, and provide non-directive support when appropriate. Discouraging the use of children as culture brokers, informing parents of acculturation programs, and use of official interpreters when needed is important. It is also important not to undermine the parental authority and provide education on how to foster autonomy while exhibiting care and affection without the double message of independence and control. As mentioned earlier, men are seen as authoritative figures in the family and provide financially. However, women are the essential element of the family. Partners will culturally limit personal disclosure to one another in fear of being perceived as weak and confiding in friends before spouses. Increased stress related to the immigration and acculturation process predisposes these couples to marital conflicts. Russians will not typically seek the help of marriage counselors due to negative experience with a psychiatrist in their native country. During the Soviet Union era, psychiatry became a tool of power and control in the communist rule. In Russia, psychiatry did not require a license, and patients were being forcibly treated in mental health facilities without any repercussions to unethical practice. This led to mistrust in American psychiatry, medicine, mental health, and social services. Men of Russian culture have an exceptionally high rate of alcohol dependence, placing the woman at an increased risk for domestic violence. Despite these problems, overall couples report being satisfied in their marriages. Unsolicited support from friends and family is viewed as caring and highly valued. Russians frequently report decreased mood and satisfaction with life, oftentimes having less control over negative emotions around strangers. This population is predisposed to depression, having a shorter life expectancy, and an increased risk for suicide due to immigration and cultural integration stressors. Routine medical visits are viewed as trouble-seeking. To have success with these patients, nurses and healthcare providers must enhance rapport building and inform of the American ethical responsibilities, hopefully reducing the stigma of mental health. There needs to be a balance between directive and non-directive approaches in medical interventions and explanations for the non-direct approaches. Nurses should screen for depression and alcohol dependence, PTSD, and domestic violence. Teaching on the necessity for routine medical screenings is important in providing preventative care. Since this population values relationships, enhancing social support is key, and utilizing family, friends, and Russian community groups. As aforementioned, typical Russian homes are three-generational, stemmed from viewing the placement of elderly parents in homes as shameful. Older adults have oftentimes immigrated to follow their adult children, who immigrated out of fear of being alone and separated from their children and grandchildren. Once here, they anticipate a better life, having unrealistic expectations of the American country. These elderly clients are left at home while the adult child works, leaving them lonely and depressed. These clients often speak only Russian, causing feelings of isolation. The stress of immigration and resettlement leads to increased physical illness, depression, and intergenerational conflict. This culture expects medical cures for all illnesses due to Western medical advancement and surgeries compared to that of what was available in Russia. Having the Soviet mentality of, if it's free, use it, these clients will overuse free programs such as Medicare, Medicaid, and Social Security income that are offered in the United States. Having somatized their loneliness, these clients will seek out medical treatment for psychiatric matters, resulting in multiple healthcare visits. The idea is that if they have good health, they can be less dependent on already burdened adult children. With limited income, these clients will often seek out prescriptions for medications and medical supplies that could otherwise be purchased over the counter. If a prescription is not received, these clients will shop around with other providers until they get what they want. Nurses and providers should provide support to these clients for their loneliness and depression, while also educating of the role of primary care providers in America. Medical interventions should highlight the benefits of community programs such as adult day health. Attempts to manage care and decrease use of unnecessary services should be performed. It is important to promote appropriate, timely, cost-effective use of health care services to this client population using interpreters if needed. Due to acculturation, traditionally, multi-generational homes are being split into individual homes. This has led to Russian elderly living together in subsidized housing units, creating in essence a Russian community. Providers should emphasize the benefits of the use of community centers and resources such as adult day health. Centers of this sort would benefit from permanent bilingual, bicultural staff members. In these formal and informal communities, people of the Russian culture have the ability to share knowledge of community resources such as healthcare, transportation, and opportunities for involvement. As it has been reinforced previously, in order to provide culturally competent care to people of the Russian culture, healthcare providers need to gain trust from the clients. It is necessary to inform these clients of the American ethical principles of healthcare delivery. The use of less formal, socially friendly environment can aid in the building of trust. A balance of direct and indirect approaches to therapy is desired, providing flexible and adaptive treatment plans. Use of basic clinical principles is not to be forgotten, continuing to assess self-care and curative practice and client values and beliefs concerning health screenings. Discourage the use of children as culture brokers, using translators when necessary, and promote autonomy in not only children but older adults as well. Being available to answer questions, familiar with cultural norms, and facilitating a trusting environment will prove to be essential to providing culturally sensitive care to the Russian clients. This concludes the PowerPoint presentation. I hope you enjoyed the material and have gained a better sense of Russian culture and how to provide culturally sensitive nursing care to these clients.